Hey everyone, welcome back to another episode of Discussions with Dr. G. I'm Dr. G, and if you're new, you're in for a treat, because today we're peeling back the layers on something at the root of literally everything we do in community nursing. Yeah, I'm talking about culture. Not just food festivals, not just language, not just whether you call it soda or pop. Culture is this whole stew of shared values, beliefs, traditions, and practices, plus the way we communicate, think about health, and even how we make decisions in our families. And let me tell you, if you skip culture, you're just not doing real nursing. And it's not like every group is this big monolith, right? Even within a group, you've probably heard described in a textbook as Asian American. You've got like folks with roots in Korea, Vietnam, the Philippines, mainland China, similar on paper maybe, but their actual health practices and beliefs, totally different flavors, different stories, sometimes even right down to the preferred home remedies or hospital etiquette. Here's one that stuck with me. A couple years ago, I had this patient, a young teen with new onset diabetes, and her family was, how do I put this? Living that food is lifestyle. Lots of traditional foods. Think rice dishes at every meal. Now, diabetes education tells us low carb count everything. But you try telling a grandma her family can't have rice, and well, good luck. I realized quickly that if I didn't respect that family's food traditions and work with them to find what was realistic, we'd lose trust, and the patient's health would spiral. So we made a plan that didn't erase who they were, just kind of adjusted the portions and timing. Did it require creativity? Yeah. And honestly, that's culture's job in nursing care. It influences health beliefs. If people even think medicine will help them, if they want their whole family in the room making decisions, all of it. You mess with culture, you mess with health. Simple as that. So, if you're still listening, you're probably thinking, okay, brilliant, Dr. G, I get it. Culture matters. Now, what do I actually do? Great question, future nurses. There are, believe it or not, actual frameworks for this. Let's do the highlighting tour. You've got Leninger's sunrise model, which is super visual. You literally imagine the sun coming up with all these rays pointing to things like technology, religion, folk practices, family. The goal? Figure out, am I preserving the tradition, accommodating it, or, when need be, figuring out healthier alternatives without bulldozing someone's identity. Next, there's Geiger and Davidhescher's model. Think 6 domains: biological stuff, how people talk, how they use space, perception of time, social organization, and who controls their environment. I always forget one. Oh, right space. Because yes, personal space is a whole thing. Then Purnell's model blows it up even bigger with 12 domains, zooming out to family, the individual, even global society. And Campina Boccate? That one's all about process. Awareness, knowledge, skill, encounter, and desire. You keep moving along, getting sharper in each dimension. Now, you want to really nail culturally competent care? The American Association of Colleges of Nursing, try saying that 5 times fast, lays it out. Learn the factors that shape people's lives. Actually use evidence to guide care. Fight for safe and quality outcomes for everyone. Stand up for equity and social justice. And keep learning. Yeah, being a nurse is basically a never-ending group project. Let's look at this in action. Picture a Hispanic grandma, late 60s, chronic health issues, speaks mostly Spanish, and let's say lives with a big family who's totally devoted, but not always sure what the doctor's saying. You combine your frameworks, maybe you work with an interpreter, pull in your understanding that family will want to help make choices, and you never ever assume you can just swap in a healthy American diet for foods they know. Suddenly your interventions aren't just safer and more effective, they're actually welcomed. That's the point. All right, but let's zoom out for a second because health isn't just about what happens inside the clinic. Social determinants, things like poverty, housing, education, job opportunities, these set the stage. You might be teaching someone about diabetes management, but if they can't afford fresh produce or safe places to exercise, your lecture isn't going to matter much. You see, you'll see this play out over and over. Black Americans dealing with brutal history of racism in medicine, sky-high IV mortality, or increased rates of kidney failure tied to diabetes in Hispanic populations. It's not about people making bad choices. It's the system, people. Let's not kid ourselves. The CDC actually calls systemic racism a public health threat. When housing is unstable, when schools are underfunded, when health information isn't available in your language, you end up with disparities that shouldn't exist. Even organizations like the ANA are finally saying, yeah, we need to get real about equity for LGBTQIA folks, race, language, income, the whole spectrum. So what do you do when you're on the front lines, feeling like you're MacGyvering care with limited resources? You work with what you've got. You show respect for religious and dietary customs. Get interpreters. Involve the right family members. Question your own biases. Avoid making snap judgments and always build in time for listening. Nurses, whether you're brand new or you have survived as long as me, you are the change agents here. You bring holistic care. You advocate for fairness, even if it means ruffling some administrative feathers. And you keep pushing for evidence-based, culturally safe interventions. All right, if your brain isn't mush yet, give yourself a pat on the back. We've barely scratched the surface of culture and health, but hey, one podcast episode at a time, right? There's loads more to dive into, so don't drop out now. I'll see you in the next one, and we'll go even deeper. Until then, keep being the nurse who actually gets it.